Hey everybody, it's Dr. Jessica Vogelsang with the Veterinary Telemedicine Community Facebook group, and I am so excited to welcome Dr. Sally Foote, who is an animal behavior consultant from Foote and Friends. We're going to be talking about behavior, a little bit about teleconsults, and do you refer to what you do as low stress or fear free?
You know, both. I am certified by both. I guess in a way, I'm an author on the Fear Free program in the Module 1. And my clinic, Oka Veterinary Clinic, was the first low stress handling certified practice. So we were one of the first people to not only take the course, but then as my entire practice were certified. I also was the executive director of Dr. Sophia Yen's company from 2016 until the end of 2019. And I created the feline handling poster that's available through Cattle Dog. So I have a pretty strong attachment to low stress handling. I have an attachment to Fear Free as well. Branding is something one needs to be a little careful with as we talk about each other, but I'm on both sides. I'm red and blue.
Okay, fantastic. So, the take home for everybody who's listening is you know what you're talking about. You have been doing this
nice to go to the vet. That's my unbranded words. I help to make it nice to go to receive veterinary care or to go to the veterinarian.
I love that. Fantastic.
That's it, because that's what it's all about.
So I wanted to talk about what you do in two different ways. But the first thing, because I think this is really important, and we were actually speaking about this before we hit the record button, is one of the things that you do is offer teletriage consults for behavior. So if you could just kind of explain what you mean by that and how that relates to the VCPR.
Okay, thanks.
Or not.
Yeah. So I feel it's best whenever we're, speaking, that we're using the correct terms. And the term telemedicine, I'm finding in a lot of articles and writing, is being used as the general term for what we're doing right now. For example, a video chat, being online and a virtual experience. Yet the proper terms are telehealth means anything anybody accesses online, even reading a blog, right? Or sending an email to ask a question. Then teleadvice is just like if you called me on the phone and you're a client and saying, hey, my pet is having a loose stool and vomiting, what should I do? And it's 3 minutes before I'm closing and you live 50 miles from an emergency clinic. But so now I'm giving you advice, even if you're not a client. I'm legal to do this, and I can do this over video chat, and that's teleadvice. And then in that moment, I would be providing teletriage. Is your pet walking? Is there any blood, right? I'm triaging how urgent it is to then direct you to a veterinarian or give you advice to manage until you can get to your regular veterinarian, because maybe it doesn't sound that extreme, to have to go 50 miles to the emergency clinic. That's teletriage. And then telemedicine is when I have actually examined your pet in person. And in the state of Illinois, we cannot establish a VCPR via any telecommunication device. So then going back to the Model Practice Act by the AVMA, I have to function and practice for a VCPR that I have actually either laid my eyes or my hands on your pet within the last 12 months, consecutive calendar months. So that's when that would be telemedicine. So in my case, as a behavior consultant, we rarely see our own clients with a VCPR. Why? Because my clients on the first day they come in, not only low stress handling, but we ask intervention questions to nip those behavior problems in the bud. So it's very rare of my own clients where I have a VCPR that I was providing veterinary care for. I received the referral from self-referral and veterinarian, so I don't have a VCPR. And I found that using a video chat, it really not only kept me safe, because the majority of cases are aggression. Or the animal is highly anxious about, and sometimes travel, unknown people. And so now we're actually, felt it was poor on the dog or cat's welfare to travel in and have them become anxious and then be there for 2 hours for a behavior consult. And even though it was nice to be one-on-one for coaching some things like training, that was barely 10% of the time spent in the behavior consult. So especially on some of these really aggressive cases where like, well, he doesn't like anybody he doesn't know. It's like, yeah, right, I'm not going to get hurt. Let's do this by video chat. And as long as I am not prescribing, I'm not diagnosing, I'm not prognosing, and I report back to the primary care veterinarian, and the veterinarian and I have our doctor-to-doctor chat about what medication or what maybe I am suspicious of a medical exacerbator. Then that veterinarian is the one to contact them for the medical care, and we all work together. I found that to be a really good way to work. So I sold OCA Veterinary Clinic. That was my practice in September of 2018, the general practice. So I'm still able to do behavior consults. And I just said, I'm going to do this all by virtual, video chat as a tele-triage service to the veterinarians that already had a relationship with referral, and also when people would self-refer. So that's how I do it all now.
And I think that's really interesting that you made that differentiation because, and correct me if I'm wrong here, that means that you could talk to anybody, right? It doesn't just have to be people in your state. So you could do that, but you have this other element that I love, which is the fact that you also do the teleconsulting. And so I think there's so much fear in the veterinary community. It's like, just some yahoo's going to be giving advice. And it's like, well, one, that's already happening. That's what Dr. Google is. So this way, that it's not a Yahoo, it's you, and you're really, really experienced, but you're also going to give the other veterinarian, the one that they have that trusted relationship with, the benefit of your advice.
That is so important from a couple of different points. And I'm glad you used the word trusted, because that's absolutely it. First of all, yes, clients may self-refer, right? How many clients tell their vet, hey, my dog almost bit my grandchild, right? Yeah. Almost bit my husband as he was trying to get the dog off the bed, almost bit my daughter. We don't hear about those because they're the near misses, right?
Yeah.
Maybe we hear a little bit about, well, he's getting kind of cranky. And this is what people might say. And we're like, what do you mean by cranky? And then we're thinking like, oh my gosh, I can't deal with this. I've got an appointment every 20 minutes. Oh, brother. Yeah. It's what I call the big black hole of behavior. And so maybe the veterinarian says, well, maybe we should put him on anti-anxiety medication, and they're not quite sure what else to say. And maybe they say, go to this behaviorist that's 2 hours away, but they're booked up for 3 or 4 months, as it turns out. And the client is kind of like, I don't know where else to go. And so for that veterinarian to direct somebody to someone else, veterinary or not, this veterinarian has to know what they know, because it's an extension really of that primary care veterinarian's trusted relationship to who they're referring to.
Yeah.
And as a veterinarian, I was just talking to a non-veterinary behaviorist about this, that everybody knows what it takes to become a DVM, basically, right? You have to go to college, you have to go to 4 years of veterinary school, you have to pass a national board examination, you have to pass a state board examination. As a veterinarian, I know you as another veterinarian knows your fundamental knowledge and, education. If you have a special interest, or special level of knowledge, when you share with me kind of some of your credentials or what you know, I can relate immediately to that, right? So this is an easy referral to a veterinarian because I trust you, right? And so now I can pass that baton of trust with my client to you. And the more open you are with me, the more collaborative you are with me. It increases my trust in you and your trust in me, and then the client's trust in both of us. And we all win. We all win. Now if you just are like, Dr. Foote, you don't know what the heck you're talking about, I'm going to refer me again. And okay.
I think your long list of credentials would make that highly, highly unlikely. But I love that. And I think that's not anything that's changed with anything that's going on recently. I mean, that's always been the case that we could do that, but maybe people are just paying attention to it more. The other thing that you do, when I was checking out your website, you have so many awesome educational resources. And one of the things that you speak about a lot is, because you're certified in fear-free and you teach low stress handling, is right now a lot of things have changed. And even when you have a pet come to the clinic, a lot of times the owner's not going with them, which is probably extraordinarily high stress. So can you talk about some of the things that you're teaching and sharing to help mitigate that?
Sure. I did just recently do a webinar called Low Stress Curbside Care. And the focus of that webinar is not about all the sanitation, et cetera, and the steps we need to do ourselves for the curbside care. The focus is on how we approach the animal, how do we get the animal out of the vehicle while maintaining the client staying in the driver's seat, how do we, while keeping the stress of this patient low. Because when they're getting separated, many of them, when they're getting separated from their owner, separated from their own car, and they're not accustomed, the dog is not accustomed to an unknown person walking up to the car. Many animals are like either not scared or they get defensive, right?
Right.
So I am showing not only how to make it less stressful on the animal, but also keep it safe for the staff. So, and wearing a mask doing this,
Right.
and so I'm acting out in parts of it, as I'm going through the education, but I show how to use a blanket for hooding quickly, like over a small dog in the back seat who, while tossing treats, would put his head through the hospital clinic leash, because we need to use clinic leashes, right, for security, so we don't lose them, they don't escape. And then he wouldn't come to me. I was like, okay, hang on. And I got the towel, a thick blanket, and showed how to quickly drop it over the dog's body, scoop him up and pick him up, and he relaxed because the blanket is blocking his view of me. It's all about, as we call, managing the triggers. What upsets the dog, like the sight of me in a mask, the sight of me, I'm going to need to, sort of reach in or approach him, scares him. But at this time, the people who are coming live to our offices are for needed care. This is not stuff that we can typically reschedule. They may not be medicated either because maybe we didn't see them before, because if we don't have the VCPR, we cannot do a telemedicine consult. You're gonna have to bring them in, right? And if we've never seen them before, then we can't prescribe the medication either. So, or maybe because they've had vomiting and diarrhea, it's like, I don't know if I really want to give them, trazodone to be even more quiet. How quiet is he because he's dehydrated? Between how quiet is he because it's the trazodone, right? So they're going to most likely to be unmedicated, needed care. That therefore we also have physiological stress in addition to psychological stress. So that's what I cover, and I give, I think, 6 different techniques and modification on the low stress handling techniques for how to get them out of the car safely, how to return them back for dog and cat, how to hold them for the blood draw, et cetera, when we're in the office, and then tips on actually euthanasia, when we're gonna have to do curbside euthanasia. And then a couple of tips on telemedicine, telehealth consult, and like utilizing, FaceTime, call them, you in the exam room, call them back out in the car and hold the phone right in front of the pet so the client can talk to the pet across the phone. It's like a virtual way of having the client in there.
And I think the euthanasia, and I'm really glad that you brought that up, because I saw, I think at one point, one of the recommendations was, look, the client, you don't want to separate the client from their pet. So why don't you call in an in-home visit veterinarian? And they're going, whoa,
No,
I'm not doing that right now. So
I agree with that.
Yeah. So having ways, and I was thinking about that too, because now you're hunched over the pet, and
right, exactly. People are crying, their nose is running. No, this is not the time for that, but it's tough. And, I addressed, how you could set, say, like the blanket on, if you're going to do it outside, pull the car somewhere that the car can create a visual screen for some privacy, put the blanket on the ground. You're going to give an intramuscular, if you can, give them, dispense oral sedation, so they're already pretty quiet coming in. You're going to do an intramuscular injection in the car. They're going to fall asleep in the car. I mean, you just reach in the back seat and give it, or wherever. And then we're going to move, say, the dog, or if it's the cat, outside on a blanket, maybe next to the car with the family, sitting in the car where they can witness it that way. That's about the best, frankly, we can really do, sanitizing surfaces and so forth. Or the animal might be transferred to the back of the pickup truck, right? Or the back of the SUV, and you will do it there. It will make it less convenient on us, yes. It is going to be a little more physically challenging to be bending over or hunched over, but people are going to have to stay at least 6 feet away because they are going to cry. And it is going, and that's contagion for us. And I also expressed really seriously about giving ourselves a bit of self-compassion for that this is going to be difficult. People are going to be more upset. People are going to be really more distraught because they cannot hold them and they cannot say their goodbyes in the same way. And we are going to be bearing witness to that, and it is not our fault. We did not bring this pandemic on. We didn't do this. So I said, you're going to have to find a way to cut yourself some slack on this one. And so one of the things I suggested was a memorial service. After some things have settled down, especially for the clients that have had to do, a curbside, whatever, euthanasia, because they are going to be experiencing a lot more grief, and it's going to help ourselves. When I started doing memorial services at my practice once a year, it was right after Christmas time, because we would have, the pictures, angel ornaments on the tree, the pets who had passed away during the year. And then we did a little memorial service right after New Year's. It was so beneficial to myself and my staff. I never even realized it till the first year we did it. We did it every year. It was very popular.
Oh, that's so lovely. And I think that idea of self-compassion is also just kind of across the board so important right now. I mean, when you hear stories about these poor souls that are passing away in hospitals alone, and they can't even have funerals, it's not just us.
I know, it's
horribly stressful to everyone. And so this idea that we should put ourselves at risk, we do need to sort of acknowledge that as well. So this is all amazing information, and I want to make sure people know where to find all of this. So where should they go if they want to take advantage of all these great resources that you have?
My website is drsallyjfoote.com, so drsallyjfoote.com. And when you get to the homepage, there's actually 3 tabs. One is the veterinary professional tab. So I have a page of downloadable handouts that are free. I have the Ladder of Aggression for Cats that I've published, the Ladder of Aggression for Dogs from Dr. Kendall Shepard that's linked there. I have the Storm Butterscotch's playlist for storm fears and noise fears, and some other handouts there. Then I also have some selected videos from my YouTube channel that are featured there. And also then there's a page that'll link you back to the shop. And in my shop, I have race-approved continuing education programs. And then I also have information about my certified puppy behavior consultant course there. And then there's a pet owner tab. In the pet owner tab, I have some resources that are written more at the pet owner level, and videos a little bit more, instructional, like for the pet owner. And then in the shop, there are webinars on demand. These are all on demand, so they can repeat them 100 times if they want, on like 5 simple rules for keeping your cat in the box, and the Big Bad Boom webinar about thunderstorm fear, written for the client level, and some other resources for the client. So if you can't, you can't do a behavior consult with your client, maybe you can't afford to contact me, whatever, or even like it's early, it's not a huge problem, but gee, we don't want it to get to be a big problem. Referring clients to these webinars, that's my goal, is to help have solutions for the general practitioner to be able to intervene with behavior early, but we're not going to try to make these practitioners become behaviorists, because it's a lot of work, and it may not be their interest, and that's fine. So, and then there's also a pet professional tab that's for like the dog trainer, the dog groomer, and that kind of blends those 2 things.
Great. So this is a valued resource, not only for yourself, but for your clients, because I think a lot of times when somebody asks us, where should I go? And we're like, I don't know. They want you to recommend something, right?
Yeah.
Great. Oh, well, fantastic. Thank you so much. Really appreciate you taking time to talk with all of us. And I know that you're active in the Facebook group as well. So thank you so much for that.
Well, you're welcome. And thank you for this opportunity to talk.
All right. Thank you.
Mm-hmm.